Hi everyone, I'm Mona Karimzadeh,
And I'm Manuki Matus.
and we are doctoral students at Rice State University School of Professional Psychology. Today we'll share our literature review on the role of maternal hypothyroidism in autism spectrum disorder. We'll look at what the evidence says about risk, current treatment regimens such as levothyroxine, and the big research gaps that remain unexplored. If you'd like to see the full poster, feel free to scan the QR code on the screen. And now let's get started. First, let's talk about why maternal hypothyroidism matters and how it may intersect with autism spectrum disorder. Maternal hypothyroidism consists of an elevated thyroid stimulating hormone, also known as TSH. During early and mid gestation, the fetus is entirely dependent on maternal thyroxine for their brain development. When the maternal supply is suboptimal, several studies suggest neurodevelopmental consequences. A recent systematic review by Kaplan et al. Evaluated 15 cohort and case control studies. 12 of these reported a statistically significant association between maternal thyroid dysfunction and ASD diagnosis later on. Complementing those findings, Guiton et al. 2018 observed that maternal hypothyroidism was linked to about a 30% increase in risk of ASD, with the effect being slightly more pronounced in female offsprings over male offsprings. Now let's focus on the specific neurodevelopmental outcomes, most often linked to maternal hypothyroidism. The first one is intellectual disability and IQ. Multiple birth cohort studies show a downward shift in offspring's IQ when mothers have hypothyroidism, while another study found both hypothyroidism and hyperthyroidism associated with lower IQ and reduced gray matter. The next one is autism spectrum disorder, and as I mentioned in the last slide, a consistent association has emerged between maternal hypothyroidism and ASD. The next one is ADHD. Evidence is less clear regarding maternal hypothyroidism and ADHD, and findings remain mixed, and it needs further research. And the last one is developmental milestones. Children of mothers with hypothyroidism are more likely to show delayed sitting, crawling, and fine motor coordination. And overall, this data suggests that maternal hypothyroidism can influence a broad spectrum of neurodevelopmental domains and showcase the importance of the timely thyroid optimization. And now Manuki will talk about effects of the treatment and outcome.
So, levothyroxine is currently the most utilized treatment for hypothyroidism, and physicians usually recommend that mothers with hypothyroidism should increase their dosages during their pregnancy. The treatment seems to restore the maternal thyroid hormones back to healthy levels, and these hormones are crucial for fetal brain development. However, some studies have found that when levothyroxine treatment is given to pregnant mothers, there are no significant differences in the offspring's IQ, brain development, or social behavior compared to the healthy controls. While levothyroxine is generally regarded as a safe treatment option, there are still some side effects, such as a potential higher rate of preterm birth and a potential higher risk of gestational diabetes, which is important to be aware of since gestational diabetes has its own complications and has been tied to ASD, ADHD, and more, according to a study by Tang et al. In 2013. Overall, levothyroxine is still recommended as an effective way to maintain thyroid hormones during pregnancy, and the potential benefits currently outweigh the risks. The main research gap is that we currently don't have any longitudinal studies that have evaluated the treatment of levothyroxine for maternal hypothyroidism in relation to ASD in the offspring. Some of the main takeaways are listed on this chart, and what's important is based on this information, we inferred that a levothyroxine treatment regimen for maternal hypothyroidism may be able to decrease the potential risk of ASD. So you can scan our QR code for our references, and thank you so much for your time for watching.